Good morning, everyone. Thank you for joining us. We are going to start our event shortly, which is strategies to reduce your risk of cancer. And as Dr. Ashraf will explain in a minute, we're putting on these events because we're trying to encourage prevention and different strategies to help us live a healthier lifestyle. We will be running through a short presentation, and then there'll be the opportunity to ask Dr. Ashraf any questions through the comments, and I will then feed them back to her and she will be able to answer them on the screen. At the end, we'll be putting out a feedback form for you to fill out to feedback on your experience of this event so that we can continue to put on events like this. So now I will bring in Dr. Ashraf.
Hello, hi, hello everyone. Thank you for joining us at Hall Green Health. Because of the pandemic, we're doing this as a virtual live event. Obviously, we would love to do this, face to face in one of our large seminar rooms at the practice for our patients. But we're doing it digitally at the moment. For patients that don't have any digital means, we have printed out the presentation for them to come and collect. We hope that you find this useful. I'm very passionate about prevention, so preventing diseases happening in the first place. And I feel very strongly about making it easier for our patients to invest in their health. So, for example, we've got a lot of patients having extensions or having their kitchen enlarged, which is great because they're investing in their house, they're investing in their personal space. But, have you thought about what you have done or what you'd like to do to invest in your health? Because what you do in your 30s impacts your 40s. What you do in your 40s will impact your 50s. And likewise, if you're in your 50s, what you do now will impact your 60s. So I hope these educational events inspire you to make those sort of challenging behavioral changes and just inspire you to think about what you can do to look after your health. So next slide, please. So I'll go through the presentation. If you have any questions, please do write them down in the comment box. At the end of the presentation, Phoebe will read out the questions and then I'll be able to answer them. Please do feel free to write any question. Would be very happy to answer them. So this presentation is about reducing your risk of cancer. Now, what is cancer? Well, cancer is a disease caused by uncontrolled dividing of abnormal cells in a part of your body. So it's an abnormal cell growth. Now, we know that there are various risk factors and that these risk factors increase the risk of you developing this abnormal cell growth. So I'll be covering the risk factors that we know, which are smoking related, alcohol related, related to your weight and your eating habit, related to your activity levels. I'll also be encouraging our patients and staff to sort of seek medical help early. And finally, I'll be going through all the national cancer screening programs, which are there to help you. So a screening program is a program designed to help find cancer before you get symptoms. And I'll go through that in more detail, which is, again, it's all about prevention and finding things early. So next slide, please. So smoking. So smoking is a huge one. And I'm sure a lot of our patients are aware that smoking is linked to cancer. Most people are aware of lung cancer, but smoking is linked to a number of cancers such as bowel, liver, kidney, bladder, some blood cancers, mouth cancers, and your food pipe cancer as well. All the evidence suggests that quitting smoking reduces your risk. And don't think that, oh, I've smoked for so long now, it doesn't matter. The evidence shows that as long as you quit, your risk does reduce. And to help that, we have our NHS Stop Smoking appointments at the GP practice, but these appointments are here for you. But it's all about your mindset. It's all about, you have to be at the right moment in your life to commit to this. So no stressful events, in a positive place, and you actually want to quit. So when you have those attributes, please do book into our one of these appointments, and we will go through the various techniques and strategies that we have to help you quit. And all the evidence shows it is so difficult to quit by yourself. Whereas if you do it on scheduled appointments, on a regular basis, then you're more likely to quit, and you're more likely to then stay off smoking. We have various, we have patches, tablets, sprays, we have all types of things to help you with this. But again, it's about being at that right moment in time where you can commit to the appointments, and we are here to help you. Next slide, please. Yes, so just to say, this presentation will be recorded, and we'll put it on our Facebook page for our patients to watch at a later time. Right, so the next one is alcohol. So in this area, so Birmingham has been split into north, south, east, west, and central. So we are part of the central locality, and alcohol in the central locality, so in this area of Birmingham, is one of the highest causes of death because of liver disease. So liver disease is one of the highest causes of death in this area. So we know that that this is affecting a lot of our patients. But not only liver disease, alcohol increases your risk of cancer. So it will increase your risk of liver cancer, breast cancer, mouth cancer. And so it is absolutely essential, if you can, stick to the recommended weekly limit of 14 units. We advise that if you want to reduce, to have some free days each week and spread your drinking. So 14 units is roughly equal to 6 pints of average strength beer, 10 small glasses of low strength wine. Next slide, please. So what I've done is on this slide, I've just put what units are, because often when we say, stick to 14 units a week, that's very difficult for people to calculate how much they're drinking. So we've put this here. So for example, a glass, a small glass of red wine, for example, is 1.5 units. So you can then calculate how much you're drinking and whether you're drinking within the recommended amount. So just to highlight again that alcohol does not only cause liver disease, it also increases your risk of cancer. So drinking less and sticking to the recommended amount is absolutely essential. And unfortunately, the central locality, which is where this area is, one of the highest causes of death is from alcohol. Next slide, please. Right, so this is a really, really tough one. So this is about eating healthy and maintaining a good weight. So weight reduction is hugely challenging. And so what we say is to do it step by step. Look at your portion size. So look at how much you're eating. Look at what you're eating. Look at when you're eating. I mean, nowadays we see people eating when they're driving. We see people eating all the time in between their 3 meals. We see people eating when they're stressed. What we try and say is to stick to 3 meals a day with healthy snacks in between. But what's happened is with the easy access to food now, it is very difficult to eat within set times because you can just press a button on your mobile and have a meal delivered to you. Look at how you are cooking your food. Have you tried grilling? Have you tried baking? How much takeaway food do you have? How much processed food do you have? How easy is it for you to cook from fresh? And remember, you can use tinned food as well to increase your vegetable intake. And have you tried experimenting with different recipes? Are you just cooking the same meals that you're familiar with? Try different things such as kale or lentils, or I don't know how many of you have heard of buckwheat. Again, just try something new. Next slide, please. So when it comes to eating, I normally say to my patients is to think of food in terms of carbohydrates and protein. So the carbs are your sort of bread, your rice, your potatoes, your pasta, these are your carbs. So think of these as your carbs. Your protein is your sort of chicken, fish, red meat, white meat, eggs, cheese, and protein is in the sort of very sort of green vegetables such as broccoli, spinach, asparagus. So think of your food like that. So what is on your plate? Do you have carbs? Do you have protein? And what people may not be aware of is that obesity increases your risk of cancer. It increases your risk of cancer of the breast, the liver, the stomach, the bowel, the ovary, womb, kidney, and all the evidence that we have. And I've put links on the evidence, so you can actually go and click on the links at the end of this presentation and look at the evidence for yourself. So, for example, an obese woman is 2 to 4 times more likely to develop womb cancer compared to a normal weight woman, or people who are overweight or obese are twice as likely to develop liver cancer compared to normal weight people. And if you're a postmenopausal woman and you're obese, there's a 20 to 40% increased risk of breast cancer. So there are links at the end which show where the evidence has come from. So next slide, please. So again, so when it comes to eating, it is so easy for us to say, well, increase your fruit and veg. It's very easy for us to say that. But how do you do that? How do you increase your, your vegetable intake? So what I said earlier is to think of food in terms of your carbs and your protein. Now, a lot of people, when they think of a plate of food, because, we have very sort of busy lifestyles, they will just think of sausages and mash, carbs and protein, or, steak pie and mash, or chicken and rice will just be on their plate, or lamb and rice, or meatballs and pasta, or, cheese and a baked potato. So those are your carbs and those are your protein. And that's what a lot of people eat. But that's not a balanced diet. That's only your carbs and only your protein. So what we say is to make some small steps. Don't make radical changes, because that's unlikely to be maintained. If you make small steps, then that's more likely that you will commit to that and maintain that. So start by adding some salad. The problems with salad, when I've said this to my patients, is you've got to make sure you have some in the house. You've got to find it, you've got to wash it, you've got to cut it. And some of them have said it just takes so much time. But just having, some salad on the plate, as you can see, you've then divided your plate into, it's not just carbs and protein. And ideally, if you want to go a step further, is the plate at the bottom, is to think of your plate in terms of 4 quadrants. So reduce your carbs to 1/4 of your plate, reduce your protein to 1/4 of your plate, make the salad the same amount as your carbs and protein, and add some vegetables. So vegetables, you can, if you don't have time just have tinned vegetables, sweet corn, peas. If you're lucky enough to have a steamer, steam your vegetables. Steamed broccoli or asparagus is absolutely delicious. And try new vegetables, such as lentils, chickpeas. You can roast kale with a drizzle of olive oil. That's really nice. So think of your plate in terms of 4 quadrants, and think of your food in terms of carbs, protein, salad, and vegetables. And that way, you're having a balanced diet and you're reducing your carb and protein intake and you're increasing your salad and vegetables. Next slide, please. Right, so being physically active. So it has been really difficult, especially, with the pandemic, getting inspired to do things. It's just so easy just to stay in the house. You don't need to join a club. You don't need to, join the gym or go swimming or tennis. Being physically active could just mean a walk. So what we say is just think about going on a walk. Just, even just 10 minutes, just get out the house and just go on a walk 3 times a week. That's the start. That is you being physically active. If you want to take it a step further, we advise go on a brisk walk where you get out of breath. And again, do that 3 times a week. Start with just 10 minutes, work your way up to 20 minutes. Get other friends and family involved, because then you're more likely to commit. But again, this is all about your mindset and being in a place where you're comfortable to commit to something. It's easy to do it once or do it twice, but it's about, can you maintain it week after week? Pick something that you're more likely to maintain, because it can be very, very difficult. Next slide, please. Yeah. Just to finish on being physically active, think of being physically active like taking a tablet. We give tablets for various diseases, but think of being physically active that actually I've got to go out for my 10, 20 minutes, because that's like me taking a tablet. Right, so the next one is protect yourself from the sun. Yes, so too much exposure, excessive exposure from the sun increases your risk of skin cancers. So it's really important you put your sun creams, especially like the lovely sun that we've had lately, your sun hat, look at the time you're going out. The peak time is sort of from 10 a.m. to 4 p.m. How long you're going out for, avoid getting sunburnt, because sunburn, is not good for you. Avoid the UV tanning beds. Again, that's exposing yourself to a lot of exposure. And if you have any new mole or changing mole, or you're unsure about any moles, or the moles are causing you symptoms, such as they're causing you pain or they're bleeding, or you notice a mole is not, it's not symmetrical, it's growing irregularly, or you're just not sure, seek medical advice early. We look at moles all the time. Because of the pandemic, what we're now doing is we're asking for you to send in digital photos of your moles. If we're unable to view it properly, we will then book you a face-to-face to actually have a good look at it. So we are still viewing moles, and we are still referring any moles which we're unsure about. Next slide, please. So seeking medical advice early. So don't put off seeing the GP. So we do get some late presentations of cancer, because sometimes patients are just scared, they're just worried, they don't know what will happen. They're worried about going to the hospital. Just come and see us, come and talk to us. If you find a breast lump, for example, just make an appointment. You can do it through our website, our online appointment request. If you get bleeding after the menopause, if you have weight loss, such that you notice your clothes, your clothes are getting very loose. If you're worried about a mole, or if you have sort of blood in your stools and you're not sure what's going on, please do seek medical advice early. Next slide, please. So so now I just want to talk about the cancer screening initiatives. So cancer screening is about performing sort of tests or to detect cancer early before you get symptoms. So we do this in our healthy population, in our healthy patients. So for example, cervical smears. So cervical smears, so if you're female, from the age of 25, every 3 years, you should get invited to have your smear test. And this is to detect cervical cancer early. It's really important that you attend your cervical smear. We have, during the pandemic, we've put extra cervical smear appointments. We've offered weekend appointments for working females who are unable to attend during the week. So we've tried to accommodate our patients as much as we can. And this is for your benefit, that we detect any abnormal cells early so you can get treatment early, because cancer is all about getting the right treatment early. So it should be every 3 years, from 25 years to 49 years. And then after 49 years, it's every 3 years. And then after 50, it's every 5 years, because the risk of cervical cancer, it decreases. So the next one is the Bowel Testing Kit. So for bowel cancer, so there's a national screening program. And through the national screening program, our patients who are over the age of 60, every 2 years, should be receiving a bowel testing kit. And this comes directly to their home. They're asked, it comes with instructions, and they're asked to pop in a stool sample and send this back in the free post envelope. So as a patient, if you're over 60, every 2 years, you should be getting this. You follow the instructions, you give the stool sample and you post it back in the free post envelope. And what the studies have found, that 98 out of every 100, they don't need any further tests. And this, they're testing for, it's something called FIT testing, where they're looking for blood in your stools. And if they do find blood in your stools, you will then automatically be directed for a very urgent hospital appointment for further investigations. So this screening process, it bypasses the GP, and it doesn't come from the GP practice. This comes from the National Screening Program team, and they can fast track you to a hospital appointment if your FIT test is positive. If you're not sure how to perform the test, or you haven't received the bowel kit, later on in the presentation, I'll go through the various helplines you can ring. And then the third screening test is screening for breast cancer. So this is mammography. So if you're female from 50 years to 70 years, every 3 years, you should get an invite to have imaging of your breasts to find breast cancer early before you have any symptoms. 20,000 breast cancers have been found from 2018 to 2019 at a very early stage. Next slide, please. So if you're a patient and you've been affected by cancer, or you're a patient watching this and you've been referred to the hospital to have, fast track referral because your GP was worried about cancer, and you're a bit anxious, or you just want some information, the Macmillan support team have opened their line. It's 7 days a week, 8 a.m. to 8 p.m. for any patients who've been affected by cancer, or if they haven't been diagnosed with a cancer and just been referred, and they're anxious and they just want to understand the process. This is the phone number that you can ring just to get some more information, because cancer is a very scary word, and anything related to cancer can be very frightening and very scary. So this is a line. Please feel free to ring it if you are worried. Next slide, please. If you've missed your cervical cancer screening appointment, and it's been sort of more than 3 years since your last appointment, then please, through our website, go online and through the appointment request form, just request that you would like your cervical screening appointment. We do try and follow up all our patients who've missed their cervical screening appointments, but it would also help if you followed that up as well. And if you do it through our website, you'll automatically be texted a date and time for your cervical smear. Next slide, please. If you've missed your breast cancer screening appointment, now remember I said it was everyone aged over 50, every 3 years should get invited to have imaging of your breasts to detect breast cancer early. Then this is the cancer screening hub. These appointments don't come from the GP practice, they come from the national screening team. And if you feel you've missed your appointment, please do ring them and ask for an appointment. Next slide, please. And again, the same is true for bowel screening. If you're age 60 and over, it's every 2 years. You'll be invited to give a stool sample in the free post envelope that you post back to the screening hub. They then test that for blood. If you think you're in that age group and for 2 years you haven't received it, or you've received it and now you're inspired to give your sample and you'd like a new kit, please do ring the bowel screening helpline and they will automatically send you a new bowel testing kit, because they can check on their computers when you last had your bowel screening test, and if you have missed it, they will send it to you in the post. Next slide, please. If you're affected by alcohol and you'd like some support, then I've put the phone number there. It's for our Reach Out recovery, and it's free and it's confidential. And it's for adults in Birmingham. Also, Solihull, they have the Aquarius team, which is a charity to also help. If following this talk you'd like some help on reducing your alcohol intake, then please do ring these numbers and they will help you. But again, it's about being in the right frame of mind and being committed. That this is once you want to stop. It doesn't matter people saying to you, oh, you should cut down your drinking. It's when you want to do it. You have to be inspired to do it. And this is support to help you do it, because it is very difficult to quit smoking or cut your alcohol by yourself. And all the research papers and evidence show that if you do it in relation to someone and in relation to support, you're more likely to quit, and it's more likely to be sustainable. Next slide, please. So if you want to know where I've got all the information from, I've put the links in. Next slide, please. And these are all the links showing what the risks are, how the risks are related to certain cancers, and just more information if you're if you're keen just to find out more. So I've put various links there. Next slide, please. Right, so that's the end of the presentation. I hope Phoebe will place the feedback forms on the chat group and also on our Facebook page. We're going to spend the sort of remaining time going through questions. So please do feel free to ask questions. We will answer them. And please do fill in the feedback forms on this event, and this will then inspire us to do more events like this. So thank you. So Phoebe, can you go through the questions?
Yeah, thank you, Dr. Ashraf. So first one is from Tracy, and she's asking, are the appointments online for stop smoking, or can the person come to the practice, I think?
Yeah, so on our website, there's the appointment request form. So on there, if you say you want the stop smoking, appointment, we have someone reviewing all our online request appointments, and so you can do it online. Please don't ring in. Just do it online, and then automatically you'll be texted a date and time. Please put in that online request form the days and times you can't do. So based on the information you give, you will be texted a date and time. So please do it through our website. You can do it through the website.
Thank you, Dr. Ashraf. We've had one from Alan, and he's asked, can having a continuous stiff neck be a sign of cancer?
So any persistent symptom, we will always look at. So we have some patients who have chronic pain. Any persistent symptom, what we usually do is refer you to see a specialist, for example. And a hospital consultant will then diagnose you. Now, if it's to do with joint pains, they may say, oh, you have osteoarthritis, for example. And this is a chronic condition where you can get flare-ups. So it's a condition which, it may not go, it can go away, but it can come back. So it's like a chronic condition. Or you may have some kind of inflammatory arthritis. So any persistent symptom, one of the reasons we refer you to a specialist is to make sure it is not a cancer. So cancer can present in lots of different ways. A stiff neck is very unlikely, very, very unlikely. It's very, very rare. But what I always advise is if you have a persistent symptom which hasn't gone away, please do go to your GP to make sure it isn't anything serious.
Thank you, Dr. Ashraf. Next question is from Kim. She's lost a couple of friends in their 50s with bowel cancer. She said that the screening is meant to be cheap, so why when requested do some doctors decline?
I'm really sorry to hear that, Kim. So bowel cancer is one of the most commonest cancers in the sort of, top 3 cancers, and it's becoming more and more common. So the screening is done by the national NHS screening team. They decide the age cutoff. So we don't give the screening tests, unfortunately. So if you're age 60, you have to, I think it's every 2 years from when you're 60. So it might be 62 that you get your screening kit. I agree with you that it should be moved down to 56 or even 55. And they're looking at that. Currently, they're looking at that to reduce it, and they're doing some studies. But it's not decided by us, the age cutoff. That's decided by NHS England and the screening team, and the kits don't come from us. And I agree with you that it is reasonably cheap, which is why they are now looking at a lower age group, because I think 60 is very late, especially for bowel cancer as well. So hopefully they will bring the age down, but currently it's every 2 years from the age of 60.
Thank you, Dr. Ashraf. Next question is from Amy. She says, hi, my little one has eczema, but he had a spot appear, which I thought was a breakout, but this spot has remained for around 3 months. It was a lump under a red spot initially. Now it is a red flat spot, which sometimes changes. Should I get this checked out?
Yeah, thank you, Amy, for your question. Yes, so eczema is it's a chronic condition. You will get flare-ups. It may come and go, but hopefully a lot of children grow out of eczema, hopefully. And any lump or any spot which is persistent and it's new and it's not part of their sort of normal eczema rash or normal eczema spots, then definitely, yes, I think you should get this checked out. It's very easy. You can request an appointment online through our website. Normally the reception team that will then ask you for some photos. So if you've got a mobile phone, you can send in the photos. You're allowed up to 5 photos that the GP sees. These photos will go into your little one's medical record directly. They don't go anywhere else. They only go into the medical record, and the GP can view this. If the GP is still unsure, and sometimes with a lump, you have to examine it. So you have to press it. You've got to see, is it regular, irregular? Is it painful? What it feels like? So if that's the case, then and the photos, and it's difficult to tell from the photos, and the GP will ask you to come in for a face-to-face appointment. But we've done a lot of lumps and bumps digitally through photos, and we've safely been able to diagnose them. But if we're unsure, we will always ask you to come in.
Thank you, Dr. Ashraf. Next question is from Jane. She's asked, how often should my husband have a prostate cancer check? He's 78.
Yeah, so this is a really good question. I didn't go into prostate cancer on my presentation, but if you fill in the feedback forms, which I hope Phoebe has put a link on the comments page, then we will do more of these. If these are helping our patients and beneficial for our patients, we will do more of these. And we could do one on prostate cancer, because again, prostate cancer is the most commonest cancer now for men. It's superseded lung cancer for men, but there are 2 types of prostate cancers. One are the very fast spreading ones, which you need urgent treatment, and the second are very, very slow growing, and they just leave them because they're so slow growing, they're unlikely to cause any harm. So prostate cancer, what we advise is if you have symptoms such as you're waking up more in the night for urine, you're going more often for a urine, your urine stream has changed, it's become less strong, the volume has changed, you've got dribbling at the end. So if you've got any changes in your urine, then you can see your GP, and your GP can there's a special prostate cancer blood test that your GP can do if you have symptoms. Now, you've asked for, can your husband have a prostate cancer check? If he has symptoms, then yes, please make an appointment, such as a change in his urine, weight loss, anything like that. If you have no symptoms, then it is a private conversation between you and your husband with the GP as to whether he would like to have the prostate cancer blood test. If you have no symptoms, because the prostate cancer blood test isn't 100% accurate, so it can be positive when there is no cancer there. And the implications of that is that you may then, end up needing all these invasive investigations. You may end up needing a biopsy just to prove, that there is no cancer there. So it's a discussion that you have with the GP, whether the risks, the risk-benefit ratio, that is it worth doing if there are absolutely no symptoms. So it depends on, your husband's past medical history and things like that as well. So if you'd like a prostate cancer check, again, through our website, on the appointment request form, just say, I would like an appointment with a GP to discuss, prostate cancer. And if you have symptoms, please do write the symptoms down. If you don't have symptoms, and the GP will go through the risks and benefits of having a prostate cancer blood test when you have no symptoms. Yeah, and that's a private discussion, but it's a very good question. And prostate cancer is very common.
Thank you, Dr. Ashraf. Our next question is from Sadie, who says she's recently had a positive result for HPV. Is there not any medication or vaccine that can prevent this?
Yeah, so unfortunately, there isn't. what we advise is, it depends how old you are, Sadie. So what we advise is, just regular checks. Make sure that you're having your smears, and if you have any sort of symptoms or any issues, to make an appointment with your GP. But there aren't any medications for this. But for cervical cancer, what I didn't go into detail is that for cervical cancer, there are now vaccines which we give school children to reduce their risk of cervical cancer. So there are vaccines that that the school will give in children, again, to reduce your risks. But if you have any symptoms, please do make an appointment with your GP.
Okay, next question is, so is the risk of cancer in women who are going through the menopause higher? I think you made a reference in one of the slides.
Yeah, so it's a really good question. So unfortunately, cancer is a disease of the elderly. So the older you go, the sort of higher your risk of cancer, which is why a lot of the rapid referral appointments, they sometimes have an age cutoff. So if you're 40 with symptoms compared to if you're 60 or 70 with symptoms, your risks will be different of cancer. But the older you are, the higher your risk. So that's why, that's why prevention is very important, and all the sort of strategies that we discussed about being active, your weight, your diet, it is all very important.
Thank you, Dr. Ashraf. Another question. So when opening bowels and it's really difficult to go, can this be a sign of cancer?
Yeah, so that's a really, really good question. So with bowel cancer, what we look for in particular is if there's been a change in your bowel habit, which is lasting more than 4 to 6 weeks. So if you're someone who goes regular every day or every other day, and suddenly you're only going once or twice a week, or, your bowel pattern has changed and it's consistently changed for over 4 to 6 weeks, that's when, if you make an appointment with your GP, we will request a FIT test. So the FIT screening test, the one that the screening hub give, is different. So that one is for over 60s every 2 years. But if we're worried about a patient who has symptoms, then we can request a FIT test to look for blood in your stools, and we can investigate this further. So the most common cause of sort of straining or difficulty opening your bowels is constipation. So that's the most common cause. But if you make an appointment with your GP will go through all the other red flags, such as weight loss, diarrhea, vomiting, how much, is there any bleeding in your back passage? So this is, again, a conversation with the GP to go to look at the bigger picture and then decide whether you do need a FIT test. And this is something the GP can do, and this is not part of the screening program.
Thank you, Dr. Ashraf. Another question, please. A male friend of mine had breast cancer. Why do we not screen men?
Yeah, thank you, Howard. This is a brilliant question. And men, unfortunately, yes, they do get breast cancer. And the screening program is set by NHS England. And I think what they do is they look at the cost effectiveness of any program, and the risk benefit ratio. So I don't know why they haven't put men in. It would, I think because their risk is so low compared to women, which is why, but there may be other reasons, which I don't know. They haven't told us specifically why men are not in the screening program. It might be to do with the imaging and the techniques that they use, but it's a really good question. And, if you have any symptoms, then obviously, do see your GP, but it's not set by us, it's set by NHS England, who look at a variety of things before they set the different variables for the national screening programme.
Thank you, Dr. Ashraf. Next question here is long-term HRT treatment a risk of any cancer?
Yeah, so thank you, Sukhvinder. It's a really good question. And again, it's about the risk-benefit ratio. So a lot of our women who go on HRT are having awful flushing, awful symptoms, and it's called hormone replacement therapy. So there is a very small risk of some cancers, which is after the age of 52. So we use 52 as a cutoff. So prior to 52, estrogen would sort of, normally be present in your body and as part of your normal hormones. Hence, it's called hormone replacement. It's replacing what your body isn't producing, because unfortunately some women undergo the menopause really early, and so we put them on HRT, in their 30s, in their early 40s, and their risk of any cancer is not increased because it's replacing what their body normally should be producing. But after the age of 52, if you go on HRT, again, this is a conversation you have with your GP, that what are the risks if I don't go on it, and what are the risks if I do go on it. So there is a very small increased risk of certain cancers. But again, your GP will go through that, in a lot more detail based on your past medical history. So it all depends on the reason why you need to go on the HRT in the first place.
Thank you, Dr. Ashraf. Another question, please, of can a blood test detect any cancers, and if so, which cancers?
Yeah, thank you, Kim. So again, really important question. So the one I mentioned before is a PSA blood test is for prostate cancer. And again, it's not just a blood test. You look at the blood test with the patient's symptoms, and then you sort of make a clinical judgment. So there's that blood test. There is a new blood test coming out. It's called the GRAIL study, if anybody's interested. GRAIL. It's a GRAIL study, and it's coming to Birmingham very soon. And they're piloting it. This is a blood test to detect lots of cancers. And they're piloting it in just a few thousand patients. And if it is successful, we are hoping that they will then, introduce that into primary care. There are other blood tests, but they are sort of less specific. There are some other blood tests that we use, but it depends on the sort of clinical symptoms as well. So if I say them, it may give the wrong information, and then patients might request those blood tests, because those blood tests only make sense if you have the symptoms, because you have to look at the symptoms and the test result. And it's not black and white. So it's not, if it's positive, you definitely have it, or if it's negative, you definitely don't have it. So it's a clinical judgment, which is made based on your symptoms, your history, and the test result.
Thank you, Dr. Ashraf. We've got one from Howard saying, can cancer be hereditary?
Yeah, thank you, Howard. Yes, so unfortunately, we do see, for example, bowel cancer in 20-year-olds. They can have a certain condition called sort of Lynch syndrome, where they have a lot of polyps and things, and they can increase their risk. We've also seen some breast cancer and ovarian cancer very early, 20s and 30s, where it can be hereditary. So if you feel that you have a large amount of cancer in your family history, I'm not talking about people getting cancer in their 70s or 80s, but people getting cancer very early, you can ask your GP to refer you to the genetic centre. That there's a Birmingham genetic centre, and they send out a family tree to you for you to fill in. And based on your answers of the family tree, they can then decide that on the NHS whether you need any screening treatments outside the national screening program. So, for example, if you've had breast cancer in, 4 or 5 members of your family and you're worried about getting breast cancer, if you fill in the family tree, they have a certain criteria. They can start screening earlier for you, but this is on an individual, on a one-to-one individual basis. So unfortunately, cancer can be hereditary. But as I discussed in my talk, there are for the, for the other cancers, there are environmental and behavioral changes that you can do to reduce your risk.
Thank you, Dr. Ashraf. Just another question, please. I am taking drugs for arthritis. Does this increase my risk of having cancer?
Yeah, so it depends what drugs. So there are some drugs for arthritis that GPs were informed increases your risk of sort of heart disease, sort of heart attacks and things like that. But these, so it depends on your drug. So if you're worried about any risk from any long-term medication, because arthritis is a chronic condition, you take drugs on a regular basis. If you're worried about any long-term side effects of the drugs, then please do discuss that with your GP, who can look at your medical history and go through the risks with you. But there are, for certain drugs, there are increased risks for certain heart disease, certain heart conditions.
Thank you, Dr. Ashraf. Next question, please. My sister passed away with pancreatic cancer at 21 years old. I have problems with my stomach. Would I be able to get tested?
Hi, Sally. Really, really sorry to see your sister pass away so early from pancreatic. Pancreatic cancer is one of those cancers very difficult to diagnose, because it presents very late, and it presents with very non-specific symptoms, such as just bloating, very, very sort of, very non-specific symptoms. If you have a sister who's passed away from cancer and you have problems with your stomach, then yes, I would make an appointment with your GP. You can discuss what your symptoms are, and based on your symptoms, your GP may decide, because stomach problems, sometimes it's just an infection called Helicobacter pylori, and this is a stomach infection that causes stomach problems, and that can be detected by giving in your stools. So it might be something as simple as that. It could be, there's like 20 different things, stomach problems that it could be, but do make an appointment with your GP, especially with that family history.
Thank you, Dr. Ashraf. Just another question from Sukhvinder, which was, are there long-term underactive thyroid treatments? Are there any risks associated with those?
Yeah, so thyroid, so sort of having underactive thyroid is, again, it's very, very common. We have a lot of patients on thyroxine, which is replacement. And again, this is a drug which is replacing a drug that your body isn't producing. So it's, what it's doing, it's putting another hormone in your body at the right level. So one of the hormones has gone very high, and what thyroxine replacement does is it lowers that hormone down to a level that it should be. And there are huge risks of not going on thyroxine replacement. So if you leave your levels at such a high level, which causes the underactive thyroid, you can get muscle problems, you can get heart problems, you can get joint problems. If it's left untreated for a very long time, it can even cause a coma. So underactive thyroid isn't taken very seriously from patients. And it's about giving you giving you treatment to make your levels and having those regular blood tests to see what the levels are. In terms of risks, it depends on an individual basis. So some patients get some side effects from the thyroid replacement, whereas the majority of patients are absolutely fine. So it's just agreeing that plan with your GP, that how much you should take, how much you can tolerate, and what your levels are, because ignoring the levels, you're actually putting yourself at very high risk.
Thanks, Dr. Ashraf. I think this possibly is our last question that we've had through, but it's just from Sukhvinder, and it says, both my granddad and dad passed away with throat cancer at young ages. What are our chances of the same outcome?
Yeah, thank you, Sukhvinder. Again, I'm very sorry to hear that there's been cancer in the family and at a young age. If you've had multiple people with cancer in your family, then this is something that the Birmingham Genetics Centre do. So if you are worried about yourself, if you have symptoms, then obviously see your GP. If you don't have any symptoms, you can see your GP if you have multiple people with cancer about referring you to the Birmingham Genetics Service, where they will ask you to fill in the family tree and they'll work out your risk, and they write a very detailed letter back to you with your risks.
Thank you, Dr. Ashraf. I think that's it in terms of questions. No more have come through. So I think that might be it from us. I've just popped the feedback form link. I popped it in the chat, but I'll pop it in again, and it will be available on our Facebook page and Twitter page if anybody would like to fill it out. Thank you.
Yes, do please. Yes, please do fill out the feedback form. It will allow us to do more of these if you feel these are being helpful to you. So please do fill out the forms. And thank you, Phoebe, for helping with this presentation. Thank you so much.
Thank you, Dr. Ashraf. I think it's been really helpful. We've had some really lovely comments through from lots of people, and we're just really pleased that people do enjoy these events. And as we've said, please fill out the feedback form, because it means we can keep doing them, and we can do them on topics that our patients would like to see, and provide as much information as possible. So thank you, everyone. Thank you for your time. Thank you, Dr. Ashraf. It's been really, really brilliant.
Okay, thank you. Bye.
Bye.